PANS in pandas, the mysterious autoimmune disorder causing sudden onsets of OCD. Did you know that a tiny tick bite could change the course of the rest of your life? PANS stands for Pediatric Acute-onset Neuropsychiatric Syndrome. It is a clinically defined disorder characterized by the sudden onset of obsessive-compulsive symptoms. PANS can be triggered from a variety of infections or viruses, especially Lyme disease and COVID-19. Lyme disease causes a variety of psychiatric symptoms. It can mimic symptoms of ADHD, depression, anxiety, and especially OCD. What happens when the disease becomes psychiatric is autobodies attack the brain, specifically the basal ganglia. The basal ganglia's function is motor control, executive functioning, behaviors, and emotions. In 1998, the Lyme disease vaccine was released. The CDC criteria was developed concurrently with the Lyme vaccine. Certain key bands were omitted in the CDC test because these bands would react in patients who had received the Lyme vaccine. The vaccine was quickly removed from the market due to it giving people Lyme disease. Unfortunately, some key bands were never added back to the most commonly used Lyme Western blot tests. Because the CDC upped the diagnostic criteria, more people are being misdiagnosed, leading to serious problems such as PANS or other neurodegenerative disorders. The CDC now requires at least 5 Lyme-related bands show within your immune system, which, even though only a small percentage of the population got the vaccine. If you suspect you have Lyme disease, it is crucial that you request an actual copy from your doctor to see if any Lyme bands are active. Lyme experts consider only one band a positive diagnosis for Lyme disease. Most doctors aren't aware of the CDC diagnostic changes after the vaccine, leading to tons of missed and delayed diagnoses, allowing the disease to progress. The test above is considered a negative result according to CDC inaccurate diagnostic tools, but as you can see on this test, there are clearly 4 Lyme bands that are active, showing that at some point this person was exposed to the bacteria that causes Lyme disease. Some indicators that a person's OCD could be related to an infection. A sudden or overnight onset of OCD. New food allergies such as gluten, red food dye, dairy, or sugar. If you experience something called a Herxheimer reaction to any antibiotics, this is a die-off reaction of the bacteria and is often misdiagnosed as an allergic reaction to a medication or just being overly sensitive to medications. A history of a tick bite or living in an area with ticks. Or if you had a previous Lyme diagnosis and continue to have symptoms despite treatment. Know the signs, because adults are just as susceptible to develop PANS as children do.